here.
Yeah.
So, okay. I think, episode 40, I think it is. All right. Hey, everybody. It is Tyler Reiss with Edina Realty and Mark Benzer with Country Financial. We're here on another Zoom call with the Wright County Public Health Director, Sarah Grossish, giving us an update for COVID-19. If you remember, way back on May 7th, we had a chance to sit down and talk with you guys about what the response has been. And boy, does that seem like ages ago.
It does.
Yes.
Yeah. We were just reflecting on that as a team just on Monday morning. Where we've come, how much has transpired, the twists and turns along the way. I would say I don't think any of us thought we'd be seeing the level of disease that we have in the community right now back then. It's quite concerning. So.
I'm going to give a caveat to everybody listening right now. In no way, shape, or form is any question directed at virtue signaling or anything. This is for our viewers here, Sarah, is please don't complain about this in the comments. One, we just want to ask questions that we've heard and we want to know answers to, and Sarah's going to do her best to give us these answers. And we definitely don't want to be insensitive to anybody who's had, somebody die or some very, very affected, ill effects to this. I think everybody knows somebody that might have had it by now, but please don't take this the wrong way when we're asking, and if it seems disingenuous, we're asking for the broad local community. So please understand that when we're talking about this and asking these questions. So with that, transitioning being in there, what is the status of the pandemic locally?
Yeah. Oh boy. I can give some numbers. I'll start with that because I think they speak for themselves. I'm trying to think of how many cases I reported to you in May. 60. Okay. So there's a 6 in the number. So this morning they post numbers every day on Tuesday. Every day at 11, pardon me. So this morning at 11, we now have 8,066 confirmed cases among Wright County residents in the last 3 weeks. The total number has more than doubled. So on the 9th, we had 3,900 cases. We're averaging, I would say about 175 cases a day. We did see a pretty light posting today from MDH. Obviously, we anticipate that was, not a lot of people got tested over the Thanksgiving holiday. Testing sites had limited access. Healthcare providers had limited access as well. And some people just chose not to get tested.
Sure.
During that time. In the month of November, we had a total of 151 residents admitted to the hospital. And that represents just under half of all of our total hospitalizations to date of 308. So again, even back in March, what I remember before we had state shutdown was talking about the reason for that was the impact to our healthcare system and the strain that simultaneous flu season and COVID infection would put on our hospital systems. And I think that's what we're certainly hearing in the news. And we hear from our local hospital partners as well. They're very stressed and they're very busy, very full.
Can I ask a question on that part? Is the whole shutdown earlier this spring was so the hospitals could get ready. And those very initial numbers were extremely daunting, not to say that these ones aren't, but we've been way under what those initial projections are. When they said, we were thinking maybe Minnesota was going to have 120,000 deaths this year. We're way below that. My question is, we're seeing a lot of reports, and whether it's national news or local news, is the regular flu's not being as reported. Is that something that the actual public health department gets as well, or is everything just kind of being spit out on the media as COVID?
So I can explain a little bit about that. So I'd like to address the first comment. So the models that we saw, and I mean, models get refined, right? It's a pandemic. Our response is refined. And I know that they've continued to work on them. That was if there were no mitigations, right? And we've instituted several. There was obviously the government mandated ones, the shutdowns, the different dial back measures and dial forward that have been managed at the state and some degree the federal level, because there was a federal shutdown for a time period as well, supported by our president. And then, this is going back so many months. It's a long time.
Yeah.
And then when you ask about flu, I think there's a couple of things to remember. We are getting flu reported. It is less. What we also need to remember, and there is flu surveillance that happens. So some of the tests that are available to folks actually do dual screenings, and they'll test, test for flu and for COVID. We actually had an incredible utilization of the flu vaccine this year in Minnesota, but I believe also across the nation, for that very fact. People who'd never taken it before, people who had been inconsistent, really wanted to take advantage of the flu vaccination process. The other thing to remember is that the way flu circulates internationally, we're not the first part that it starts in. It starts actually in the southern hemisphere and then moves into the northern hemisphere into the United States. And obviously there's just not been as many opportunities for that transfer amongst populations because people are not doing very much international travel. So that, I believe, has probably impacted. I think some of these questions, this one included, are things that we will know more about a year, 2 years after we've implemented vaccination and COVID and been able to really analyze some of the patterns. People who have, a lot of access to data, just not only in Wright County, but across all of our states, really see how flu has been impacted. Measures that we take to reduce the transmission of COVID also reduce the transmission of flu, which is good. Mm-hmm. Other thing to remember. So it doesn't surprise me that number's down. Your question was, it is surveyed for. Again, there are oftentimes in previous flu seasons where a provider might say, it looks like the flu and may not swab. And actually we have that happen for COVID as well. They'll say one person in your house is positive. You also are symptomatic, just assume you're positive. Mm-hmm. That's not something unheard of for a provider to say because testing resources at different times of our response have been limited. Mm-hmm. And it's not unheard of for a provider to say, 3 of your kids have these symptoms. One of them's tested positive for influenza A. Probably all have it. So
sure. Yeah.
Numbers in both cases.
Yeah. Cool. You had mentioned a little bit about I think you touched on vaccine a little bit, but what it sounds like, we're recording on December 1st, that I'm hearing maybe by the end of the week that some vaccines might be rolling out. What is kind of the latest and greatest on vaccines at this point, and what is your department's role in vaccinating the public?
I'll give you kind of the landscape for that. So today, December 1st, is the meeting of something called ACIP. So that is a federal group that meets to discuss vaccine distribution plans. It's called the Advisory Committee on Immunization Practices. It's probably something nobody ever knew about prior to this, except for those of us in public health. It determines actually all of our immunization schedules for childhood immunizations and other different immunization programs. And they talk about flu vaccine every year as well. Obviously, a lot of attention on them. They're meeting today to discuss priority groups. And we have a couple of vaccines that have applied for but have not been granted yet conditional use, emergency use guidance from the federal government. So that has to be approved as well. I don't know if I'd say this week, but we've heard as early as perhaps the 18th that there would be vaccine available in the country. And it has to, I mean, it's gone through all of their regulatory processes for the conditional use.
Has there been conversation on how that gets implemented within counties, or what the conversation between the county level where you're at and then the state level? Is there any information flowing down to you guys?
So, yes. So we have a local plan, phase 1 plan. I mean, we're talking about phases. That we submit to the state, which would be the Minnesota Department of Health in this case. Minnesota Department of Health also submitted a plan to the federal government. So, and right now the federal government is determining priority populations and their distribution plan. A lot of the logistical pieces, I think people probably heard, there's quite some interesting logistical hoops that we have to, primarily the federal government and large support organizations like UPS are figuring out how to work with ultra cold storage, and many of those initial rounds will not come to local public health. We do not have the ability to accept, and we do not have the type of storage, the amount of vaccine that would come in those ultra cold, deliveries. They'll be very large volumes, 1,000 plus, and they have to be, if they're not stored at the ultra cold temperature, they have to be distributed within a very short time frame. And they're for a targeted population. So they'll likely go to our healthcare providers. We're working with, every region has a regional healthcare preparedness coalition, and we as well have one. It's based in St. Cloud with CentraCare. But it represents all of the healthcare providers in our region.
Sure. As we're talking about healthcare providers, I don't remember if you gave us the capacity. Does Wright County have a number of capacity of beds available? We heard a lot about that. We still hear a lot about that, whether it's ICU or not ICU, or which one's COVID related. Is that anything that you can shed some light on?
So it's probably wouldn't surprise you and your viewers that the availability of beds fluctuates pretty regularly. And so they implement a system. It's a computer system that only certain people have access to. Hospital EDs are one of them, emergency departments, that tracks available beds. And it can be done across a large region. You know, for Wright County, we have 2 hospitals that have capacity, but we also have proximity to the metro as well as proximity to St. Cloud. And so we tend to see with our folks that are hospitalized, they are dispersed across a pretty wide area, depending on the bed availability at the time that that person needs to be hospitalized. So there's quite a bit of transferring from one acuity to another, depending on the needs of the patient at the time. And certainly, you know, we're aware of the same stories of that I think are playing out in the media, where people are waiting for available bed space, and waiting for the transfer opportunity to if they need higher acuity. So, well, it's probably not useful to hear about what is available at Wright County, you know, today at 1:30 versus tomorrow at 1:30, because again, they're looking at a broader scope there. And sure. What I can tell you is this is the first time in the past few weeks that when we see information about our cases and who's hospitalized, that we see folks hospitalized as far away as the Mayo Clinic, because that was my assumption with that, is that that's where the available bed is with the specialty that person needed. Mm-hmm. So it just makes things, I think, more difficult to think about. You could have a family member who becomes very ill and needs to be hospitalized, and not only are they not with you in Buffalo, where perhaps you feel like they're close by, you probably won't still be able to see them because they're infectious and in an isolated area of the hospital, but that they could be even farther away. And think about the burden that is on having a loved one hospitalized and being far away from you, regardless of the condition.
Sure.
What are we, I've heard some things just in terms of like, hey, we want to be testing as many people as we can, even if you're asymptomatic. What is, I guess, is there a, I guess in Wright County specifically, is there a testing procedure that you would endorse? I mean, should you show symptoms prior to getting tested, or is it case by case? What are we to do, as far as testing goes now?
So I think I'm not going to endorse anything different than what the Minnesota Department of Health recommends.
Right.
I think as we've worked, it's a partnership between our providers that provide testing and those that are community members who are deriving demand. And I would say when we look at like our calls to our hotline and our information line, the majority of folks right now are calling for access to tests. So whether or not I endorse something, I can tell you that's what the community wants, is that information and wants to know where to find it. The guidance that what has come from MDH in the last couple of weeks, particularly leading up to Thanksgiving, was that there is likely a lot of mildly symptomatic or asymptomatic folks in that 18 to 35 range. And they recommended that population, if they were considering traveling or Thanksgiving, to really get tested and try to get tested. They really want to make sure that our teachers, many of them are still in school, especially in Wright County. We have a lot of teachers still working, particularly in the elementary levels. They were offered through the governor's Safe Learning Plan access to a free saliva test. I probably was on here in May. I spent most of the summer with my staff trying to figure out how to create more access to testing. We had different issues with supply chains that impacted people's ability. That caused our healthcare providers to really tighten up who had access. So it may seem like, they don't want me to get tested because I'm asymptomatic. It was really because they were prioritizing the resource because we didn't have very much. Now we have more access, but we still, even with the access, we can't get everyone that needs to get tested. There are now delays again with the processing time because the infection rate is so high and so many people are positive.
Is the test free?
So good question. Depends on probably what you access and where you get it. Wright County was part of a pilot that is now available to the entire state. You can get a saliva test mailed to you. You can go on the Minnesota Department of Health website, or you can go on the Wright County COVID-19 page and click Get Tested, and all that information is there on how to access that test. If you have a copay, it asks you to put in your insurance information, but if you have a copay, that is covered. The state is using the CARES Act dollars to help cover those expenses. So essentially it's free. You won't receive a bill. You don't input any. If you somehow manage to get to a part of the Vault Health website where it asks for credit card information, you took a wrong turn because you never even have to put in a billing method. Yeah. So even though you're putting in an insurance card, you won't all of a sudden get a copay or something like that. That's all been worked out. If you go through your healthcare provider, you might be asked to pay a copay if you do a clinical visit. The test itself is free. That's something that's actually worked out at the federal level. So.
Sure. So it's a yes and no. If you're,
well, I mean, I'm not in charge of whether you're. I wish I were.
How I hear that as a consumer, not in the field or anything, any official capacity. So I guess I can speak with a little more latitude. It is, if you can find a free testing site and you don't want to pay anything, go there. If you want to maybe pay something to your clinic, go there, get a test, do a schedule.
Yeah, so I think it really also, one thing to think about is, at some point, if you're really ill, you probably want to check in with a doctor anyways. And so if you're really feeling sick, please make sure if you're a viewer or whatever, connect with a healthcare provider. And that might have a cost to it, right? Because you're asking for healthcare services rather than the test. If you're asymptomatic, I didn't mention, but that's also available on our website. There are several walk-in, although most of them are asking for appointments. You might have to wait quite a bit longer if you don't do one, but there are walk-in places that are available. There's one in St. Cloud, there's one in Hutchinson, there's several in the metro area where you can go get also a saliva, and some of them are still nasal swabs.
Yep. I know Brooklyn Park was a saliva test where you fill up a tube of spit. Maybe the grossest experience I've ever seen going there. But it was quick, in and out, maybe 5 to as fast as you can spit, really. But there was wide open space. It was corralled into an old Office Max or whatever it was, a Staples, whatever closed down. So, but yeah, utilize those websites to find those areas, and it wasn't hard when I went and got tested to actually find a place for that. So let's talk a little bit about if you get tested and it comes back positive, what's the county's advice on that?
It's going to be the same as the CDC and the MDH. Everybody is pretty consistent on that. You should stay home. You should go to work. You shouldn't go to school. You really shouldn't be out of your house. If other people in your household are not sick, you should isolate from them. So if you have, in my case, I used a basement bedroom when I was concerned, and a separate bathroom, or wiping down things in between and trying to mask up and stay away from folks if you're able to do that. And then you should let people know if there's people you've been in contact with. You want to make sure, and that close contact, again, is within 6 feet for a cumulative of 15 minutes over a 24-hour period. And we determine in public health, you're infectious from the 48 hours before your symptoms start. If you're asymptomatic and you went to get tested because maybe you were exposed to someone, it would be that 48 hours before you got tested. So I know that gets confusing for folks. And sometimes those symptoms, you have to remember, those symptoms can be really mild and they can appear gradually. So it's just something to keep in mind.
How long is maybe I missed it there. How long are you infectious for after that?
Right. So after your symptoms starts, 10 days. And you need to be fever-free for at least 24 hours. So if you're still really sick 10 days and still have a fever, then you need to continue to stay home. And you need to be feeling better. Not all the way better. For a lot of people, it does take a little while, but you need to feel like you're improving. I mean, all of us have probably had cold or flu before where it's kind of like, oh, that was the worst day. And the next day you start to feel a little bit better.
Mm-hmm. Yep. So clear, 10 days after
10 days.
Your positive test or symptom-free.
Your symptoms start.
Symptoms start. Okay.
Yeah. So for some folks, especially if you're trying to get an appointment with a provider, you might have to wait a couple days to get a test, or you might schedule an appointment. It is from when your symptoms start.
Sure. Okay. Thank you.
Mm-hmm.
I knew I counted right.
Yeah.
I knew I counted right.
Are you speaking from some experience?
Yeah, sure. Hypothetically.
Yeah.
Yes. No. Yeah. It was.
I think it's hard pressed in public health to find someone who hasn't at least accessed testing. I myself included. I've had my son quarantined with me a few times. It's hard with this mode of infection to not even have been exposed.
Yeah, and when I felt a little bit like something feels a little bit weird, we isolated for 10 days, and went and got tested, and it did come back positive, but we stayed home from work and school and tried to do the distance learning with the kids, and oh my gosh, it was the longest days of my life there. But I mean, we were the sick ones, not the kids. But no, we did that. For us personally, it felt like allergies. Fever for about six hours maybe. Take a nap, and that was as bad as we got it. Not to say somebody else doesn't get affected differently, but everybody in our family, that's about how they experienced it. And then where it came from, nobody knows. a little bit about the experience of getting that test is we were contacted saying, hey, you're going to be getting a call from the Department of Health. Answer that phone call. Well, with answering the phone call or calling them back, there's not, and maybe there's some communication at the county level or state level, is calling that number back is we never get an answer back, and they never follow through with questioning. Have you heard any of that?
Yeah, I don't know what time frame you're talking about, but for a while, our county did participate in contact investigations. We didn't do all of them. Well, we did probably most of them. But when school started, we had to redirect staff. We were planning for vaccinations. And so that now is managed, and for many counties, it's either all or partially managed by MDH with some contracted staff. But I can tell you, I gave an example of the Wright County numbers. That happened across the state. And you can't respond fast enough with bringing on more staff and train them to do those calls when that volume is increasing double-fold every week. I don't think it was possible. We're just seeing them starting to get on top of it, and they made several modifications. So some of the questions that we used to ask in the summer, we no longer ask, just to make the survey or the questionnaire shorter. There is a letter now and the text notification that I think you referenced, saying you're going to probably get a call. If we can't reach people, there were different pathways they would call all the time. Now they just call one on the first time, and then they wait a few days, and then they call. They are not calling every day. And all of that's incumbent, of course, of getting the right phone numbers and all of those things for people too.
Right. I could see.
I do know that is a concern across the state, that has been delayed for many folks.
The tracing or the follow-up.
Mm-hmm.
Yeah. Maybe you've experienced this is talking with people from around the state, and just kind of everybody's kind of personal thing. And I think a lot of people feel like, well, it's making its rounds in Buffalo for sure. Everybody kind of seems to know somebody, but it was even maybe a month and a half ago where you talk with some friends in other school districts, and even close of, they're hearing rumblings of these going through the schools, but maybe numbers aren't actually being reported just because they want to avoid a shutdown. Have you heard any reports like that at the county level, as far as people kind of playing their cards close to the chest of saying, oh gosh, just because I have a cold, I'm just going to stay away, but I'm not going to go get tested and fear that I'm going to go shut the whole school down or shut the whole business down? Is that happening, or are you hearing of anything like that happening?
I've certainly heard the same concerns. I'm trying to think, I think all through the pandemic, whether you couldn't access testing or you were worried it was going to cost you money, some people are distrustful of the system, don't want to provide that. There are certainly collaborations and systems worked out between Minnesota Department of Health and school districts so that positive tests are communicated with schools. They ask for permission to talk to school districts, and if permission is not granted, there's quite a discussion with the individual about why, and they try to work through that situation from the Minnesota Department of Health when that happens. But I don't have a specific example. I think there's always been some concern, but there's such a high level of virus in the community. I don't know if they're really, if someone were to do that, I don't know. It would be like a drop in the bucket compared to what's already happening in the community. Does that make sense?
Sure. I think you clarified a little bit more. It's the conversations I've had, it's always somebody's suspicious of that actually happening. No hard evidence of it actually happening, saying, why did they do that? Or why are we not seeing that person? Or is there information being withheld based on our own personal experiences? Are we being told the truth or not just to save face with our business or schools or anything like that? And you hit it on the head. People are suspicious about it. And more than likely it probably is happening, but it's impossible to trace.
I certainly fielded my fair share of people calling saying, well, I heard about this family, or I wonder if my school's doing this correctly. And oftentimes it's an education piece because we went over the 10 days, right?
Yeah.
The quarantine period is if you're exposed. And then they go, oh, I didn't understand it was that way. Or while we encourage folks to be tested, we don't force people to. And so if they choose not to be tested and they stay home for the requisite period, that's acceptable. They're not exposing anybody. And a school or local public health or the state, we don't force people. I think the other thing to remember is, I'm sure you're familiar. There's a lot of stress with this level of infection in the community and just a pandemic in general. I think we've been experiencing some degree of heightened anxiety and stress about this across our populations. And it comes out of people in sometimes not very good ways. They become distrustful of each other. We have this desire to know what's going on, but it conflicts with also our laws and our deals around personal privacy. And the fact that my healthcare information is private and I don't have to share that with you. And so I think it's always a balancing act. People want, and some people, I can tell you, even in, I'm sure in my circle of friends, your circle of friends, even my workspace, some people are sick of hearing about COVID and some people want more and more information all the time. And so people are on a spectrum of how they're handling this.
On how people are handling it, you mentioned stress.
Mm-hmm.
Has the county seen anything as far as mental health issues rising over the last for 2020?
So we are working with our sheriff's office to look at that information. I think it's something we'll continue to do. We would like to kind of survey the community and get some information probably later in the spring coming in 2021 to see how people experienced it. I don't have numbers for you today, but I think that we've seen that in our school conversations with our school districts, and it's not, I think it's not just the pandemic, right? It's not just the virus, it's all of the other pieces that come along with it, whether it's the shutdown or the distance learning, like you talked about, or there is the friction between even your comments before we even started the interview, right? So this person's wearing a mask, and all of that creates I think a heightened state, and it'll be interesting to get a handle on more of that information and data as we go along. We certainly have been watching it, but at the same time, I think what's hard too is the COVID restriction, especially when you think about where we're at right now, really prevent some of the best types of support for folks, right? So now you have teletherapy instead of in-person, the way some of our natural supports for students and kids being in-person learning has been disrupted. So it's hard to know what all the ramifications are. I think we're still in the middle of it.
Yep.
Yeah, I guess that is something that that hopefully is part of the learning process, when maybe we can look at this in the rearview mirror and say, I think it's easier to calculate a death that you can directly attribute to COVID. You get sick and unfortunately you pass away, or you get sick and you recover. But hopefully they can gain also a better understanding of indirect, losing access to your support network, or losing access to, this or that or the other thing, to kind of get a total picture of, what did we do really, really well, and what did we, where can we get better, and just some of those more indirect figures and numbers to learn, so that next time.
Yeah, hopefully not a next time.
Not next time.
We went 100 years.
I want to expand on a question there. Is with the county, is there conversation that goes upwards of that? Because, we hear the governor's his conferences of kind of these decisions being made. Is there a balancing act of, hey, what are we seeing in our own local communities, or are we just the proverbial punching bag, state down? The state's going to make the decision, you have to follow it. Or is there any saying, hey, this doesn't really correlate to our area, or hey, we're actually having a mental health issue more so than our local residents? We're not seeing, the death rate go up or our ICU rates go up exponentially like we are seeing the infection rate. Is there any conversation like that or expressed concern going the other way, to the people that are making these decisions?
There is. So we meet, my position, I'm it's a position in state statute called a CHS administrator. To some extent, let me finish my first thought. We meet with the Commissioner of Health, Jan Malcolm, and upper level management staff there on a every other week basis. And then on the intervening weeks, we meet with other public health colleagues to talk about the response. And I think that's probably true. I know, for instance, for other positions like myself, but in different areas. So for instance, I know that our superintendents meet with the Commissioner of MDE, I think on a weekly basis. So those meetings are happening in different areas across the state. And many of those commissioners then are within the response structure at the state level. They have their, the state of Minnesota has their own incident command structure and roles and responsibilities for different partners there, and information does flow up. I would say for some of our activities, I think particularly, and I can't speak to everybody, but for some of our activities in public health and human services, where by state statute, like I don't have enforcement capabilities. That's not something that I have by right in statute. That is administered by MDH. We could be a delegate, but we're still working for the Minnesota Department of Health and their guidance if we're a delegate for some enforcement. But most of the enforcement happens at that level. And that's true for a lot of our health and human service programs. They're state directed, but county administered is sort of the term.
Sure.
When you talk about kind of the broader pandemic and like if we wanted to have some different options, I know that has been discussed. I would say many of those things were on the table in October for could we have this county, and they were trying to discuss what it would look like, this county or this region maybe be open here because they're not seeing that infection, but this county or this region. And there were conversations. On what happened with that is the infection rate skyrocketed, and that was the ability to have that kind of nuanced response was basically off the table at that point.
I suppose too, there's a certain risk of if this county
Sorry?
I just kind of seeing issues where maybe if this county's open, this county isn't.
Yes.
You're inviting trouble into the county who's
Sure.
open potentially. Right. So it could
I remember
unravel
the
fairly
specific
quickly.
Conversation about this with some state folks, and they were thinking at first that maybe it would be regions so that you would not be able to have that. And I don't know. I'm very cognizant of regions because we border Hennepin and the metro region, and we're Wright County is not part of the Met Council, for instance, but many of our folks work in the metro, work in Hennepin County. Or other metro counties, utilize those resources, but we, our group is often towards the central region, which is more St. Cloud centric, and we have a population that goes there. And so for me, one region never feels like it's the right fit. And I could imagine a situation like you're saying, where even within a region, one region's doing this and one region's doing that.
Sure.
And then the idea that counties within a region would agree with each other. There are very different mentalities between individual counties. So
people don't always agree.
Right. So while it seemed like on paper like a great idea, it seemed like a big lift to implement and something that would take time. And in the meantime, we got to a place where Minnesota and the states around us are pretty much the epicenter for the United States for cases.
I've seen some theories on that as when things were hot and people were down south in air-conditioned areas, they were rising in their infection rate. Now, in the north, as things get colder, we go inside where the heat is, it's raising here. And everybody's kind of doing their own different thing from South Dakota to Minnesota, Wisconsin. Earlier this year, back in May, I think you gave us a C or a D as far as response to everything.
Oh, I think it was from a website, though.
Oh, okay.
Well, my actual grade, but yes, I've seen that. It was from social. I don't even know if they're still doing that.
I didn't get through our whole episode. I was listening to it earlier today, but I think it was a C or a D. And now it's seemingly, I mean, you go out in public, I'm assuming that even masks are worn at a 90+% when you're out in public at the stores, everything like that. Yet we still got hit so hard. Can we even control this? I mean, it's a good question. With the mask mandate, everything still went way up.
So, I think there are still areas where mask wearing is not consistently applied. I've certainly experienced that personally. And that's, I know that.
Could you give us an example of where you see that?
I mean, because it involves a business, I'd rather not,
Sure.
because I don't necessarily think it reflects on that business. But there are places where mask wearing is not consistent. And I think there's different approaches that different businesses take about how they choose to enforce that. Obviously there are some folks who feel like for their health reasons, they maybe aren't able to wear a mask. They choose to wear a face shield or something like that. But I've seen flagrant violations of it in places. So
overall, what do you think the percentage of usage is?
I know that it has definitely increased, and I feel like even now it is increasing as soon as we started to have the doubling of cases and the skyrocketing and 200 cases a day, the increase in our death rate and the hospitalization rate really caught people's attention. And I know even anecdotally, it's only December 1st, and in September and October, we were doing targeted communications to some of our communities where they were lax and saying, hey, the infection rate is growing here and it's going to impact schools. And we would see behavior increase. Compliance, I should say. But masks are one tool, right? So they're a tool, and they work alongside other guidance, which is the social distancing part and the not gathering in a bunch of groups. So some study of behavior across the country, and the data was released in the last couple of days, most recent data, was people became fatigued about not having small social gatherings as early as April. And so, and at some point we reached a tipping point where you can't have 5 friends over for a barbecue when they're also doing that with some other people on a different day, or they're still seeing grandma who's seeing their cousin who's, all of a sudden what you thought was just your 2 friends or this other family in your bubble actually includes all these other people. And so it becomes really, I wonder how many of those folks were wearing masks while they, had their little barbecue in the backyard with their friends. Sure. Probably not, right? And what we're seeing in our cases is either people, it's pretty split. Most people, we still trend toward most people don't know where they got it. but then we have a good portion that know where they got it, and it was because we went to a birthday party or barbecue, and they think because it's not a small group of people and it's people that they know that it's going to be safe. What becomes really difficult with this virus and requires that vigilance is the fact that you can spread it while you don't have symptoms. And so you feel fine and you feel like going to the barbecue or playing, kids play together or something like that. And then the next day they get the cough and the sniffles.
Sure.
By that time, it's too late. The exposure's already happened. I think we can see from other places around the world that we can control this, but it takes a lot. When you talk about the rearview mirror as well, I don't think it's lost on any of us at the local level that Minnesota may be doing one thing and we're following what Minnesota's guidance is, but then we have different guidance in all the states around us.
Sure. Yeah. Maybe you said around the world. Is because there's so much information out there in the United States, is any of that information believable when it's not even inside our own borders? You said if we're going to shut it down for one instance, me personally, I don't trust any information coming out of China saying, nope, we've got zero, or North Korea, for example. That's maybe the best one. Nope, we have had zero infection rate here in North Korea. Well, if it's as bad as it is, I don't think I believe that for one hot second. Is that information even reliable worldwide when it's seemingly, and again, just looking in the media, that the United States has really put a full effort in tracking and testing and trying to get a hold of information? Are other countries even as diligent as that? Or are we just hearing the highlights or the good parts of something else?
Well, I guess it depends on where you get your information from. When I think about where I'm talking from a public health level, we get research papers and stuff that's vetted, and many of those go through a scientific review process that was in place prior to COVID. So, the expectation of how they collect their data, what's being collected, how it's being analyzed and how it's being portrayed. That was a process that was refined and vetted way before we had, COVID to deal with, and it's being applied the same way. So we'll continue to look at that information from other countries. I mean,
it's kind of taking them for their word. It
has to be reproducible. And so if one country does one study and we do the same study and we get the same results, that's reproducible. Right. And I guess
my question, the results are only as good as the input put in. Is maybe my observation, because we do see polarizing studies. And again, this is the internet. So, and I don't read scholarly papers.
I think we run into a situation where I myself, I can use myself as an example, have found quotes and information on the internet where I'm like, wow, that's different. Wonder where that information came from. And I research the study itself. And I find that what was represented on the internet was edited. I found that it was the quote from the beginning of the article and taken out of context. I actually did this yesterday. Someone had quoted a quote from the maker of the PCR test. He's dead. He's been dead since 2019. So his comments were not related to COVID and were taken out of context. I think I literally did just do that yesterday. So I think when we talk about information, it's really making sure that we have what is fully represented. I don't know if I would, a byline, a catchy catchphrase, a meme, a picture doesn't always give you all of the information.
Yeah. Yep.
So, for sure.
I mean, I would agree in some instance with you for sure about sometimes the title of a news story or the information doesn't represent everything that's in that article. So then it becomes incumbent on reading the whole thing, really understanding it. And that's why, where for me and for folks at the state, and I think at the federal and international level, people will be comparing notes, and they will be, I think your comment too about, as we look in the rearview mirror from this, it's going to be looking at everything, all the data, how it was collected, who did it, how, even to the, when we do survey design, for instance, we ask, it's even, I'm sure you folks are probably aware of this. You can ask a question slightly differently, and that drives how people answer it.
For sure.
So.
No, I think that's great. And I think there's a lot of good information and knowledge being shared, numbers being shared, which is always great. And also you have the distinct honor of being our first repeat guest on the Buffalo Community Podcast. So that's kind of a big deal. I wish it was under different circumstances.
Let's see if I got this right.
I feel like I need a badge.
Right. Yeah.
Can you hear that? Audience applause.
Yeah. So we really appreciate you coming back on. I don't mean to cut this off, but
we're approaching the 1 hour mark here.
Yes.
Do you have any closing thoughts? Sorry, I totally cut you off.
I think I don't know if I covered half of what staff prepared me with, but one of the things I think would be worth is, thinking about March when we're talking, maybe even a little bit earlier, but thinking about coming back, and maybe I'll bring a couple of staff who are really into it, but talking about vaccine, because I think there are going to be a lot of questions.
Yep. All right.
Awesome.
Well, for the Buffalo Community Podcast, I'm Tyler Reiss with Edina Realty.
I'm Mark Benzer with Country Financial.
And online with us, we've got Sarah Grosich of Wright County Public Health.
Thanks, everybody.
Thanks,
Stay safe.
Sarah.
Thank you.
Appreciate it.